8-year-old Amadou recently recovered from Noma, a little-known tropical disease that kills 9/10 of its victims if left untreated. Many who survive Noma have facial disfigurement. Although Noma has scarred his face, Amadou, relatively speaking, is one of the lucky ones. If Noma is diagnosed within the first few weeks of infection, it's easily treatable with a course of antibiotics.
We noticed the disease in the run-up to Christmas. To begin with, he said his mouth ached to the point where he couldn't eat anymore. He even had great difficulty drinking sachets of water.
Compaoré took his son to the nearest city, Kaya, about 25 kilometres away, where medical staff could identify the disease thanks to awareness building by the Swiss non-governmental organisation Sentinelles. Sidi Omar Boena is a nurse at a Sentinels medical centre in Ouagadougou, specialising in the treatment of Noma.
In most of Burkina Faso, health workers have no idea about the disease Noma, so diagnosing it in people 400 to 500 kilometres from Ouagadougou is very difficult.
He says that he's sometimes forced to diagnose Noma with photos sent to him via WhatsApp. Odette Serene, who also suffered from Noma, now receives regular follow-up treatment at the Sentinels clinic, including support in finding a job.
I am a tailor. There are people who laugh at me. When they laugh at me, it makes me sad, but the nurse has helped a lot to take care of me.
Noma is just one of many illnesses that are currently missing from the World Health Organization's list of neglected tropical diseases. Doctors Without Borders, a medical NGO, is running a campaign to have Noma added to the WHO list, which already includes diseases like rabies and dengue fever.
At community level, because there is, of course, discrimination affecting the patients. And so every time there is a case, we might not even be aware because they are hidden by the communities or they are dying. More than 90% of people are estimated to die.
The WHO says when it adds diseases to the list, factors like social stigma and death rates are taken into consideration. But resources are limited, so some diseases have to be left off. WHO press officer Ashok Molu explains the effect of adding a disease to the list.
It really brings the disease or the condition to another level. If it is category A, then a global program is built around the disease to tackle the disease. It also adds to the advocacy part of the disease, awareness creation, and also resources.
As for Amadou Compaoré, he says what the doctors have done to help him has been an inspiration.
I want to become a doctor, to treat people, so that they will be cured.
The WHO plans to make possible new additions to its neglected tropical diseases list in 2023. It remains to be seen if Noma will be among them. Henry Wilkins for VOA News, Kongusi, Burkina Faso.